Hi everybody, my name is Banji David and today I'll be performing an NG tube insertion. So before anything else, as a nurse, you have to know why you're doing the certain procedure. So an NG tube is used for people who cannot eat orally or somebody's on a trach or ventilation machine. Air or gastric contents can be aspirated from their stomach, for sample for this one. Okay, so also visually inspect your patient. Is your patient actually a good candidate for this one? If there's any facial trauma or bleeding, gastric bleeding, perforation, this is not for that type of patient. And also, if the patient's on anticoagulant therapy or platelet below 50,000, be cautious because they are at risk for bleeding. All right. And also, once you get an order for this one, for an NG tube insertion, inform your patient right away. Make sure that they know what is going to be done to them, how it's going to feel. Make sure that you get their consent before anything else, because some do refuse, okay? And if you have a lot of patients for the day, and if you gathered all your supplies, you've lost time and effort, and so you have to work smart. All right, so let's go through our supplies. We have a towel, we have our water for sipping, our 60 cc, 60 ml syringe, some towels, so our gloves, of course, page strip, lubricating jelly, some tape, and of course our emesis basin. And sorry for show our NG tube. So an NG tube, it comes in a packaging like this, and take note of the size. Very important. I have an 18 French here. Make sure you take note of the size and it's right for the patient, because you will be documenting that later on towards the end. All right. And what I don't have here is the suction canister and the tubing. If you're doing this at home for a patient, usually they have a portable suction machine, and if you're in a facility, it would be on the wall, all right, to attach your NG tube at. All right, so let's start. May I come in? Thank you. Hand hygiene. Can you please say your name for me and your date of birth? Thank you. Yes, Mr. Sunny. Again, my name is Manju David. I was here a while ago and I asked for your consent, and you did approve for this NG insertion. I was just wondering if we could do that, can proceed with that as of this moment. Thank you. So let's start. So everything that you do, you have to let your patient know, okay? Make sure they know what you are doing. So I performed hand hygiene. I put my gloves on. First things first, we have to know which nostril you're going to use, right? Whichever is patent. So let's get our pen light. We're going to visually inspect first. We're looking at any deviation, any obstruction, none there. And also another check would be have them blow on one there. Blow please, Mr. Sunny. And please blow again. Thank you. So that's another check. So I would use the right nostril for this particular procedure. So now let's first prepare our patient. We'll put a towel over their chest. We have our emesis basin. There will be a point that the patient will gag. Of course, we have a gag reflex. Once it reaches that at the point of around the nasopharynx, they will start to gag and they may have emesis. So make sure this is ready. And also have everything within your reach, which is very important. So next step, usually this would be in warm water, just to make it more pliable for insertion towards the patient, into your patient, okay? And all right, Mr. Sunny, at this point, I am just going to first measure as to how much tube is going in, okay? And to do that, we will be starting from the nostril. I'm sorry, we are measuring from the nostril, going to the ear, all right, right there, and down to the xiphoid process. Okay, so this tube is usually marked. I'm showing here 45. Some would use a Sharpie, but for me, I would use a tape. Some would just not use anything and they forget. So be safe. There you go. That is the length that is going to the patient from here to there. Okay, Mr. Sunny. Now we're all set. Make sure the patient is comfortable before we do anything else. Make sure they're in a high Fowler or semi-Fowler procedure if tolerated. All right, depending on your orders. Check your orders again. All right, make sure your tape is handy nearby. All right, and we have our lubricating jelly. I'm just putting some lubricating jelly, Mr. Sunny, just to ease the insertion. Okay. And also let me know throughout the procedure by raising your hand or your finger if you need to tell me something, okay, along the procedure, and I will stop. Okay. Now we are lubricated. We are now going to start insertion. Oh yes, also by the way, with this tube, we are not using this blue one. All right. This is for an anti-reflex valve right here, which is inserted through the end. I just want to inform you that. That's to prevent any secretions from coming out from the patient. And we'll be using this side for the suction, okay? And for feeding, right? Okay, so now we start. We're now going to insert. Also, how do we insert? We are going to go straight, not up. Anatomy, go straight and down. Okay, that is how the anatomy of the face and the esophageal area works. Okay, all right. So now at this point, Mr. Sunny, you're gonna feel uncomfortable, and just let me know if you need me to stop along the way. Okay, all right. We're now inserting slowly, moving it. All right. At some point, if you feel any resistance, move back and relubricate or move into another nair, okay? At this point, we're not feeling any resistance. All right. So once we reach, we reach the nasopharynx area, this is the time when the patient will probably start gagging, okay? And so you're gonna ask them, you can have somebody help you with this, you can ask them to sip water slowly while inserting. Okay, once they sip, you insert 5 to 10 cms. Okay, so let the patient know that that will help the tube move down better. Okay, just to help you out as well. All right, so once you get past that moment and the patient is not gagging anymore, meaning you are in the right area. Okay, not much and not much uncomfortable feeling. Yeah, there's not going to be much uncomfortable feeling there anymore. Okay, and at this point, once we're in, we're just going to advance slowly. Okay, all right, and we reach our point right there. See how that's very helpful. So once we reach that point, we're now going to check for placement. Very important. Okay, there are 3 ways to do that. First is through air. Remove this. So we're going to listen. You will hear a whooshing sound once you hear the air. You'll hear a whooshing sound once you inject the air in. Okay, so aspirate probably 20 mLs of air. You place it on this end right here. Have your stethoscope ready. You're going to place this on the epigastric area. And we're going to inject air and listen to that whooshing sound. Okay, so you heard it. That is this check is not usually very reliable, but do it still. So the next check would be through a pH strip. So you're going to aspirate some gastric content, just a little bit, 10 mLs. All right, aspirate that gastric content. Get your pH strip, place in a drop, wait a little bit. So you have an indicator here as well. If it's green or from 0 to 4 to 5, you're good. It means you have gastric contents. You're in the right place because you do have gastric contents on this pH strip. Okay, that's part of that. And the very important check, make sure you have this, is a KUB or an abdomen X-ray, kidney bladder, ureter bladder scan, or an X-ray. So that is a very good indication of golden standard rule placement. Do not put any medication in or any feeding until you get that confirmation. All right, that you're in the gastric, that you're in the stomach. All right, so now what do we do next? We try to anchor the tubing. You get a piece of tape, make sure that you're still in place. All right, cut it in half like this, split it in half. We're going to put it on the patient's nose bridge right there. Make sure you check this every shift, every now and then, because we do have pores there and it could get dislodged. And you're gonna ring it around the tube to put it in place, like a candy cane, right? You know how that looks like? There you go. So it is in place. You're not obstructing the nostril for breathing, okay? And some facilities would have a transparent dressing to place on the side, on the cheeks. All right. So transparent dressing would help because you would at least see the gastric contents in the tube, and make sure at least you could see the tissue integrity as well. Okay. And for this end, make sure it's out of the way of the patient. You can tape it or have a safety pin on their gown. Okay. So make sure the patient is comfortable. Are you comfortable, sir? Able to breathe? Yes. Okay. So now that we have secured our tube, we have confirmed placement, it is now time to document. So how do we document? What are the things that we need to document? Okay, but before that, make sure patient is lowered down to the lowest bed position, safety first. Okay, all the supplies are out of the way, thrown. You're not leaving anything behind. All right, so now, and hygiene. Thank you, Mr. Sunny. I'll be checking on you every now and then. Okay, so now we're going to document the procedure. Things we have to document for is the indication, of course, of the NG tube. Why do we need to do this? And then we have the time and the date. We have the depth of the tube as to how deep we went. All right. And then we have the confirmation of placement that we did. Document that. You got a KUB order in place, results for that. We did an auscultation test and the pH strip level 0 to 4. And of course, the vital signs, it would be good to have their vital signs ready, their oxygenation before and after the procedure, and also how the patient tolerated the procedure, right? Of course, included the gagging, how much emesis was there, what type of emesis, the color, and how they tolerated. Did they say no or something? Okay, make sure everything is there. And did I say the size of the tube as well? Document that. So if everything is done, patient is comfortable, you inform the doctor that the procedure is done and they've already documented everything. So that concludes our NG tube insertion. Thank you so much. And also, if suction needs to be done, you insert this at the suction machine, all right? Or if aspiration needs to be done, you do that, okay? So this will be connected to the suction port, all right? Thank you so much for your time, and I'll see you again soon. Thank you. Bye.